Good morning, everyone. It's my pleasure to introduce our keynote speaker this morning. I'm Leo Waterston, and our keynote speaker, Dr. Lanny Graham, recently retired from a long career in public health, including serving as director of the Maine Center for Disease Control and Prevention. She continues to serve in public health as a public health committee member of the Maine Medical Association, lifetime member of the Maine Public Health Association, and as a volunteer with the Maine Frontline Warm Line. Dr. Graham, I'll turn it over to you.
Thank you very much, Leo, for that very kind introduction. And I feel like saying welcome to the Amy Coney Barrett Senate hearings, because that's what's going on now. But and I also feel like saying I should be holding a sign saying the end of the world is near, because a lot of what I'm going to be presenting is pretty grim statistics. And I found out by fully evaluating the issue of mental health in the 21st century that things are really not going well. And we have a lot of work to do. But I think that if there's any group that has a chance of making a difference, it is my public health colleagues. So maybe that's the ray of hope in this picture. Also, I would say that every single topic that I talk about is a topic that could take up an entire hour or even an entire day. So you're going to have a lot of data thrown at you, and I hope we'll have a little bit of time to talk towards the end. I do need to provide my usual disclosure. I have nothing to disclose, but along with everyone else, I want to thank our own governor, Dr. Shah, and the Maine CDC for the very hard and good work done during this pandemic. It's really been remarkable. And also a big thanks goes to the people of Maine who have complied for the most part with the recommendations that have been made. So we're ahead of a lot of other states. Thanks to the data sources I've utilized, and a very special thanks to Dr. Ed Pontius, who is a Maine psychiatrist and who helped me, has worked with me on the Maine Frontline Warm Line. As I mentioned earlier, I will be providing a 30,000-foot view to help everyone think about the heavy impact of mental illness and the lack of wellness on health, on the economy and the planet. Understand why mental health and public health have had some difficulty in the past working as a team, and identify some actions, share some predictions, and express some wishes as we in public health seek to improve mental health. This is a definition that I think everyone in public health is pretty familiar with, but for the few who might be coming from the mental health sphere, we in public health work collectively. We don't take care of individuals. We work on what are considered to be the big problems that we can identify in the population. We work collectively, and nothing is ever done in public health that is not done by work that you have to do by working as a team. Mental health, and this is a recent definition of mental health, and I think it's worth reading it out loud because it shows what a terrific impact adverse mental health can have on our whole planet. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make choices. So there's a lot packed in there. And this just is a quick outline of reflecting that very definition. Internationally, communication, diplomacy, and even nuclear war can depend on the state of mental health of the people around the world. And I must say that it was a bit frightening to me to see a security guard following President Trump to the hospital carrying the nuclear weapons um, book. Anyway, there's a list of some of the things that are reflected by poor mental health, and the list is much longer than that list. Public health and mental health, when you think about the definitions that I just provided, it seems like it would be a marriage made in heaven. So what's the problem? Well, mental health and public health have been working in entirely different spheres until about 30 years ago. We've made a lot of steps toward integrating ourselves both in the healthcare setting and also in the public health setting, but it's been a short period of time. Originally, when I had Dr. Shah's position, mental health was in an entirely different department. And it's only been 30 years since the Surgeon General first issued a report on mental health in the United States. That was issued in 1999. So we didn't find out about mental health in the United States until some 30 years after we found out about tobacco, which is kind of disturbing. Also, mental health in the past has been considered health care. So from a public health problem, I think we've tended to view it as not our issue. The focus being on individual sickness, not population health, and not prevention. Both mental health and public health have been neglected for different reasons. Public health has been neglected because the illness that is prevented is very hard to get people excited about. Whereas when you take care of somebody who has bleeding or is in the ER or whatever, those things are very clear. And I think COVID has certainly brought home more what public health does and what public health is for. On the mental health side, we've been dealing and continue to deal with bias and stigma. So much of mental health has not been considered illness, but rather character defects, which is really a terrible thing. Here are some of the initial statistics. I'm not going to be going into each one of these individually. There's just too many of them, but I thought we should pause at least on the first one. Depression is the #1 cause of disability worldwide, costing $23 billion per year. Now, think about it. It's not cancer, it's not heart disease, it's not firearms, it's depression. So it really marks again how greatly this issue can affect us all. And as a side note, there are more than 50 active conflicts worldwide going on right now. Then there is the issue of suicide. And I think of suicide, which I heard a lot of very good talks in the annual meeting on suicide. There's a lot of focus on suicide. A lot of people are doing very original and interesting efforts to try to impact and decrease suicide. And certainly that's entirely appropriate. But the truth is that suicide is kind of the last expression, in my view, of a failed system. It's the end of the stream, not the beginning. And you can see there kind of the last two bullets in that slide. Major depression in youth is increasing 4.35% over the last 6 years. So we're going to be kicking up more bodies if we don't start doing something about this. Over 70% of youth with major depression are still in need of treatment. So these are very serious problems. And again, here you see suicide, and I don't want to spend any time on this because I think it has been talked about in more detail and more eloquently by others. But I do want to draw your attention to the 3 things. First, is the fact of the veterans. 14% of the suicides are veteran suicides. That's a horrible thing. And secondly, there is a clear problem, and I think we're really beginning to appreciate that. Men account for 78% of completed suicides. So men are not getting access to care, and they're not recognizing problems that they have or ways to get out of that box. And last, the suicide rate has been going up since 1999 for both sexes and all ages. And I want to emphasize this was pre-COVID. And more issues related to national data. And again, I'm not going to go into each one of these, but I want to draw your attention to the last one, because the last bullet, because then again, it draws attention to one of the big problems that we have. Men are not accessing care and not recognizing what problems they may have. Nearly 9% of men reported daily feelings of anxiety or depression, and less than half of them took medication for those feelings or had talked with a mental health professional. Youth is particularly vulnerable to substance use, and the United States remains one of the top nations in the world for substance use disorders. We are in the top 10. And secondly, people with known mental illness, and I think this is very significant for the connection between public health and mental health. People with known mental illness die at a younger age from chronic illnesses like diabetes or hypertension or cancer. In fact, they died decades earlier, 10 to 25 times earlier. Again, worsening mental health pre-COVID. Overall, mental health has worsened in the 3 or 4 years prior to COVID. School bullying increased 35% from 2016 to 2019. And this next one is kind of an interesting fact. In 2015, the number of road rage related fatal accidents was up to 467. That was a 500% increase in just 9 years. And the involvement of a gun was also up. And that was pre-Trump. So there has been a growing of anxiety, depression, and rage for a number of years. On the bright side, domestic violence and substance use among youth had been decreasing. But now, of course, we have to think that in the face of the pandemic, that is probably not true anymore. And tragically, we have a very serious problem with caregivers. Suicide rate is higher among both male and female physicians than it is in the general population. And I think this represents another iceberg tip. I'm sure of it. Another thing that's interesting and horrifying about these statistics is that females are at a higher risk, female physicians, than males. And you know that's a reversal of the general population. Emotional exhaustion, depression, anxiety, and feelings of burnout are at levels higher than in the general population among caregivers. And one last statistic that is also very concerning is that nearly 75% of workplace assaults occur in a healthcare setting. And this was a study done in 2016, meaning that it's more dangerous to work in a healthcare setting if you're concerned about assaults than it is in, say, construction or a restaurant. So clearly, we have a lot of problems associated with the healthcare environment and with care providers. There are long hours, important decisions are being made, there's limited support, there's danger, whether it's COVID or assaults, violence, there's constantly changing rules and a lack of control. In mental health, it's pretty well known that when an individual is in a situation where they lack control, it is very difficult to maintain your emotional balance. And our American healthcare system is in great disarray. I hope it's going to change and change soon. But that's certainly one of the driving factors. Then there's finding balance between family and work. There are high expectations of self. There are quite a few interesting resources in my resource section that I won't be talking about, but you might take a look at. And one of them is a book called The Perfectionist Handbook. And we might all take a look at that, because I belong to this group. Probably everyone that's listening belongs to this group. And we really need to take care of ourselves. And denial, seeking help is a weakness. And there are these thoughts out there that it's a good thing. It shows strength if you say, well, I can live on 3 hours of sleep and 2 cups of coffee or something like that. And we know that's unhealthful. So there's decreasing access, difficulty accessing healthcare, no time, embarrassment. And then finally, there's self-care. Many healthcare providers turn to various ways of taking care of themselves, and not always with good results. I want to say just a word about the Frontline Warm Line, which I've been working on since about the first week in April. And it was set up by Dr. Ed Pontius with the help of the Maine Medical Association. And we have been, about 100 of us have been taking calls on a shift basis. And we take calls from 8 a.m. to 8 p.m. And I have 2 shifts, Wednesdays and Thursdays. And during that time, we've only had about 45 calls. And that's really sad, because we do know that there's stress out there, but they're not accessing the line. And I would say I have taken 5 calls, and all 5 of them needed help a lot. And so we know it's out there, but it's not being addressed. And I want to say a word about another presentation that was given by Elise. I think her name was Elise Pratt Ronco. She gave a talk on compassion for healthcare givers, and I recommend that talk if any of you can access it, because it gave a lot of good resources, and I thought she gave a thoughtful presentation. But one thing she said that stuck in my mind was, it's an ethical responsibility to take care of yourself. And I couldn't agree more. It absolutely is. So here is some good news for Maine compared. This is a ranking comparing Maine's mental health status with other states. So we're above the midline. We ranked 19th out of 51 overall. The District of Columbia was included. 17th for adult data and 22nd for youth data. So that's a positive thing. We ranked 5th for access to healthcare, which kind of surprised me, but I think given the amount of energy, and this is 2019, that we have put into getting access to healthcare through MaineCare and other ways, it's easy to see why that might, well, not easy, but it can be seen as the reason. An even more surprising statistic is that we rank 3rd in the nation for mental health providers, with a ratio of 474.6 per 100,000. And that would seem to be a very positive thing, but I do think that some caveats need to be mentioned. First, we don't know anything about the match between needs and availability. So this is counting everyone. It's counting psychiatrists, psychologists, social workers, healthcare providers that serve substance use disorders, those who focus on marital conflict or youth, and we don't know what the match is between what the needs are and what is available. And I think that's an area that needs to be looked into in more detail. Also, there's the possibility that some of this number is inflated as a result of people who have retired to Maine. On the bad news side, and probably this is not going to be a surprise to anyone in the audience, we ranked 34th for adults with substance use disorder, 39th for youth, and 48th for youth with at least one major depressive disorder in the past year. But the real significant, maybe won't be a surprise to you, but it was to me, Maine ranked 50th for youth with severe major depressive disorder. So clearly through our public health data, we can see that youth and substance use disorders are an area that need focus. And poor mental health, some roots here. And this is a quote from one of my very favorite medical ancestors. Do we not always find the diseases of the populace traceable to defects in society? And that was Rudolf Virchow. And there's a part of me now that's beginning to think maybe we should just do nothing but focus on these defects because there's a lot to do there. Anyway, more than 100 years ago, he figured this out, and we're just starting to get into it. Genetics does play a role in poor mental health, but not as big as some of you might think. It probably represents less than 30%, even among serious mental illness and substance use disorders, both of which have some roots there. Social determinants of mental health, I want to draw attention to another book in the resource area, which is The Social Determinants of Mental Health. It was published a few years ago, I think about 3 years ago, and it's where I got the Virchow quote. It was very interesting taking a look at that. It's something to have in your repertoire. Adverse childhood experiences and mental health, it's pretty obvious that children that are exposed to lead, for example, in the environment, they don't have proper food to eat. There's traumatic situations happening at home. These are the kinds of things that adversely impact the development of the brain and in addition, of course, ultimately the ability to withstand stress and to deal with the challenges of life. Social determinants of health can either worsen or buffer adverse childhood experiences. So for example, in my case, I had 4 types of adverse childhood experiences, but I was brought up in a middle-class home. I never had to worry about food. I always had clean water. And so, but on the other hand, obviously, if you have a difficult social environment and adverse childhood experiences, is going to be a pretty bad situation. There are unhealthy cultural norms, there's stigma and bias, and now we are dealing with the internet. So, and on the public health side, how are we doing? Well, probably again, everyone knows that this is not a good time, particularly for public health, or we've had a bad time over the last 20 years. We have seen decreasing funding while there's been increasing funding for healthcare. There's been a major attack on one of the greatest public health successes of all time, immunizations, and I'm afraid that is likely to continue. And science and data are not accorded the respect that they once enjoyed. There's going to be a high cost for mental health of big public health problems. And these are some of the, well, I've picked out what I consider 5 of the more challenging public health problems that we are facing. And we'll go into those in a little more detail. And after looking at the pandemic, so how has the pandemic affected mental health? Well, I'm sure you won't be surprised to learn that it has not improved mental health. 11% of respondents to a survey done by the National Centers for Disease Control said that they had seriously considered suicide in the past 30 days. For those 18 to 24, the number was 1 in 4, more than twice as high. And of course, symptoms of anxiety and depression were up for all age groups. And this is just a graphic representation of the same thing. So you see back in May, 34.5% of adults were experiencing either anxiety or depression. But the interesting thing and the concerning thing is that every month, just in a month, this increased and got worse. So we went from 34.5% in May to over 40% by July. And it's probably hovering in that range now. How does climate change affect mental health? Well, we have the acute impacts of natural disasters. We see out west the fires related to climate change. In Louisiana, the hurricanes. And what we're now seeing is we're giving birth to a whole cohort of people that are going to be experiencing not just acute needs, but very probably long-term effects, post-traumatic stress disorders, watching their houses burned down, all their possessions float away. And then there are the gradual impacts resulting from rising sea levels and failing crops, immigration, food insecurity, new vectors of disease. We've already seen that somewhat in May. And then finally, there is how we see ourselves as well as how we see the future. Then there's income inequity. And probably you know this, but maybe you don't know that we are now looking at a picture of income that is similar to 1920. And the 1%, the wealthy, increased their wealth 39%, while those at the bottom, 90%, that's us, fell from 33% to 23%. Well, you can almost see that the number is almost exact. So the wealthy, in fact, robbed the poor. A sort of cheerful note here is that the child poverty rate fell to a record low of 15.6% in 2016. Which was a little more than half its 1967 level of 28.4%, but that was with government assistance. And we have to look at what may be happening now. And I think we probably know that that number is not the same anymore. And this again is a graphic representation looking at income gains comparing the wealthy to the low and middle income groups. It's pretty discouraging. And once again, we find the pandemic has left Americans more vulnerable to poverty, and especially people of color. So Black families are facing a much more serious impact than white families. And this is the legacy of slavery that we have in this country. Artificial intelligence and the internet. And I want to mention here a Netflix documentary called The Social Dilemma. And if you haven't seen it, you should take a look at it because it will give you a new view of what we're facing with the internet. It's put out, it was developed by the Center for Human Technology. I love that name, Center for Human Technology. Gotta wonder what that really is. But anyway, they had people who had worked directly in Silicon Valley with Instagram, Facebook, Twitter, all of the things that we associate with the internet. And they talked about the fact that we are all being manipulated by the internet. The internet is not free. We are paying by being available to large corporations, and we are being evaluated by artificial intelligence to see what we want. So it is hard to find truth in this world of alternative facts. And it turns out that if I put climate change into my search engine, what may turn up for me, maybe hopefully scholarly articles on climate change, will not be the same for someone in Louisiana or someone in Illinois. They may see something else entirely, like it's a hoax or some other thing. And I will say another thing that I learned by seeing this is that uh, false facts travel 6 times faster in the internet than the truth, 6 times faster. So no wonder nobody can really figure out what's going on. Then there's the fact that artificial intelligence and technology may be eliminating thousands of jobs. We don't know yet what the balance is going to be, but self-driving trucks, it's been estimated at between 700 and 800,000 long-haul trucking jobs may be lost. But there may be others that take their place, such as data detective or business development manager. However, it's just another way in which we are being destabilized from a mental health point of view, where we don't have control, where things are constantly changing. It makes mental health more of a challenge. And then, of course, I think I would be remiss not to mention our aging population, since I'm aging, and also it's as the oldest state, we should take a lead in this area. And it's another case of stigmatization. Ageism in a society that worships youth is pretty significant. We know that during COVID, for the elderly, it was a disaster. In Maine, and we're sort of one of the red states as far as this goes, 62% of our deaths occurred in the long-term care setting. And then there's just the general care of the elderly. It would be good to find a new way. Wouldn't it be good if there could be a way that the elderly could become more part of the solution and less the problem? And finally, there's dementia and its impact. And every day we are seeing that play out around Maine and around the nation. So here's another one of my favorite philosophers. It's Lewis Carroll, and this is the Red Queen talking to Allison through the looking glass. If you haven't read it lately, I encourage that. But anyway, the Red Queen says, "Now here you see, it takes all the running you can do to keep in the same place. If you want to get somewhere else, you must run at least twice as fast." So I guess we really have to move faster. Public health's responsibility to mental health is to move upstream. We have to see that untreated mental illness becomes treated, so access to health care. We must attempt to eliminate bias and stigma, and I have to say that I think that's one of the most important, if not the most important issue. We have to reduce the numbers of mentally ill in prison. I want to stop here just for a minute because criminal justice reform is a favorite topic of mine, and we have lots and lots to do. The United States incarcerates more people on a per capita basis than any other country in the world, 2.3 million. Another 5 million people are on probation or parole, and most of them have little chance for employment. Most people in prison are poor, and the poorest are women and people of color. And here's a really shocking statistic. 76% of people incarcerated are not convicted of any crime. Pretrial detention accounts for virtually all of the growth in incarceration over the last 20 years. Getting to the mental health issue, 1 in 5 people incarcerated is locked up for a drug offense. Perhaps 15 to 20% of the incarcerated suffer with a serious mental illness. What a tragedy. If only 10% of drug addicted offenders receive drug rehabilitation instead of jail time, the criminal justice system would save 4.8 billion compared to current costs. And that number continues to. Then we already know about social determinants and childhood experiences. There is environmental issues. There are plenty of environmental disasters out there. Environmental justice is a problem. The poor, again, must take the brunt of living close to dumps and being exposed without having the finances to take care of their situation. So that's got to be considered. We have to normalize excellent self-care. And really that may be the cornerstone of everything. And this is just a little thought I had. Can rising levels of stress be as important as falling levels of immunization? They darn well should be. And so other concerns for public health, what about addressing other roots of poor mental health like media violence? What about expressions of other expressions of poor mental health, such as animal abuse? This is a particular interest of mine. Animal abuse has been clearly linked with other problems that may or may not be considered mental illness, but 88% of families under investigation for child abuse are also reported for animal cruelty. 71% of people who are reported for domestic violence also abuse their pets. But here's a kicker. Every year, more than 10 million animals die from abuse in the US alone, but only about 2,000 of these deaths are ever reported in the media. And then we have to acknowledge that our poor treatment of animals was very likely played a significant role in the development of the pandemic we now find ourselves in, the animal markets in China. And then maybe if we effectively address mental health, we could also more effectively be addressing some of the chronic illnesses, hypertension, heart disease, diabetes. I wanted to say a word about the nanny state because over my long career in public health, whenever I tried to do anything in the legislature or from a regulatory standpoint, I was often accused of wanting to create a nanny state. And I'll just tell you right now, from my point of view, that's where the action is, and it's not inappropriate. It's very appropriate. We've certainly learned that people, adults, need some guidance, some direction, and I don't know that they need a nanny, but they certainly need a proper approach to many of these problems that I've listed here. And all of these are going to end up being dealt with in the legislature or in Congress. Health coverage, income inequality, hazardous products, criminal injustice reform, and so forth. It's all, that's where the action is going to be. So state and federal action, full access to care at an affordable price. We need, in my view, we need single payer. Parity for mental health and assuring access to preventive services for mental health patients, reasonable medication costs. I have to probably move along a little faster than I've been going. those are some of the social determinants of health that need to be addressed: decreasing economic inequality, eliminating the environmental injustice and the toxic exposures. I want to mention the sort of the two, close to the two last ones: the strong financial support for preschool and Head Start education, very important. And of course, for us in this state, digital connectivity to create equity in learning. And climate change, these are things I want to give a shout out to the Maine Public Health Association. Many of the colleagues, Becca and others, worked hard on the Maine Climate Council report, and it's an excellent piece of work. The problem with it is that it's very hard to move forward. I think what we have is an oil, a cheap energy addiction, and it's going to be hard to move away from that. But always, really, the most important action is community action, which all of you are involved in every day. And I think that's as you gather strength, then we gather strength for the legislature and for Congress. We have to work every day to destigmatize mental health. And you, I think, are doing almost all of these things. I don't know that you're practicing and modeling self-care, but I certainly would encourage that, and I'm going to try to do that myself. For destigmatization of mental health, there's something in the resources, Deconstructing Stigma, which is a campaign and a website, and it's people from all over the country talking about their own mental health, pictures and so forth. It's in airports and other places. And I think that's a great effort. But the two things that I think are going to make the biggest difference to mental health in terms of destigmatization are, number one, leaders must set examples. And I must say, I was a little bit disappointed that none of our leaders stepped up and said, this is a difficult time, and I have done these things to stabilize my own mental health. It's not enough to say you should call this number or you need to take care of your own mental health. Our leaders need to set the example. They need to set the standard. And then last, training in the importance of good mental health should begin before school and throughout. The top three actions at the federal level: full access to healthcare for everyone, climate change action, and addressing social determinants of health with particular emphasis on criminal justice reform and education beginning at the preschool level. We really have to interrupt the preschool to prison pipeline. For integration, joint leadership for mental health population-based issues with more tracking. We have to have full ongoing financial support for public health. If we don't get it now, I don't know when we will ever get it. So we have to advocate for that. And we have to get everyone involved because it's so easy to provide financing for public health and then gradually decrease it. It's a really good idea, and I hope some of you may be working on this, to incorporate mental health promotion into chronic disease prevention efforts and vice versa. I remember about 10 years ago when I worked briefly in mental health up in the county, I was surprised to find no one had their blood pressures taken. Most of them were not familiar with whether they had a high cholesterol. And in fact, I identified some serious cases. On the other track, in general, people who focus on physical health have a tendency not to recognize that after a heart attack, someone may need some emotional support. Not only may need it, but should have it. The driving forces for the future are the oppressive population artificial intelligence and the internet, the limitation of resources. In the end, we're going to have to be more population health driven and less personal care focused. That seems obvious. For predictions, telehealth will be routine. Artificial intelligence will become much more significant for diagnosis and care. And the approaches to all aspects of mental wellness will become more standardized, but not less individualized. You can see from what I talked about with respect to the internet and artificial intelligence, it's quite possible to develop packages that are individualized. But it's going to be a process. I'm hoping that with learning self-care, that medications will be less central to good mental health. And I think the kind of helpline, which is psychological first aid that I've been involved with, will become more common and varied and hopefully accessed more frequently. My wishes for mental health, some of the more unacknowledged signs of poor mental health on and off the internet will be tracked and acted upon vigorously, like animal abuse. That's obviously something I care about. Full integration of mental health and wellness with healthcare and public health. All stigma will be lifted from mental health. The internet will get much needed quality control, and good self-care will be routine. In terms of self-care now, I think all of you probably have thought some of this. I hope you have, but you really need to dig in. Make self-care a priority. Say so. I'm taking care of myself by doing these things. Disconnect from the electronics and social media. Be aware of your own signs of stress. Consider the strategies that can reduce stress. And I think getting out in our beautiful state can make a difference. Engaging in activities that provide meaning, like I'm doing now, and get help from a professional if you need it. And it's a strength, not a weakness. For the future, self-care must be taught to children before school starts and throughout. Self-assessment will be part of the learning, so people will know when and how to help themselves, when to seek professional help, and when to call 911. Simplicity will be key. The internet and artificial intelligence will increasingly be part of the teaching staff, but quality control will be vital. That is really something that has to get some attention. The internet, of course, right now is like the wild, wild west. So I'm going to conclude there, and I think I've left a little bit of time, but I feel that we are so lucky to live in this beautiful state. This is Monhegan Island, and we can get out in nature, and this is Maine's 200th birthday, so as a state. So happy birthday, Maine, and thank you all for listening. And I think that's it. So I don't know if I mentioned, I think I might have forgotten to mention the questions. Maybe they could be asked now if they haven't already been asked.
Yes, we are going to go to the poll question, which the first question is, what big problem that we are facing with an impact on mental health worries you the most? And the responses are coming in now. So I'm going to read off some of the responses in a moment. Just give it another few seconds to come in. Okay. So looks like 40% are saying the internet and social media, about 24% climate change, 19% for income inequality, and about the same for the COVID and other pandemics.
Wow. So
there.
Yeah, so it's pretty evenly split, although people are more worried about the internet. So that suggests that we need to put some time and energy into that issue. when I watched the Social Dilemma, one of the speakers said, I always thought that the internet was going to be a force for good, um, but now I'm not so sure anymore. So it needs quality control. And the
Great,
second,
thank you. Yes, the second poll question is, what is the biggest barrier to achieving mental wellness for all? And responses so far are about 60% for stigma, about 31% for lack of access to healthcare, and about 12% for poor leadership. And nobody so far indicating lack of a well-trained workforce.
Okay, well, good enough. I mean, that's my my prejudice is definitely that stigma is a huge issue, but it's tightly connected in my view to poor leadership. So, you know, until leaders are willing, I mean, they're showing the way. If they're not willing to say that you need to pay attention to your own mental health by saying that I'm doing that, then others are not going to follow. And of course, we've already seen a lot of evidence of poor leadership with respect to that. So anyway, well, I'm happy to answer any questions anybody might have. It's got a few minutes, I guess, not too many, but a few.
Great, thank you so much for a great presentation.
Yeah. No questions. I've answered all the questions that anybody might have. That's okay.
Looks like, yes, it looks like there's one submitted question. After watching The Social Dilemma, or maybe before you saw the documentary, do you have a social media presence?
I do not have a social media presence. That might be partly due to my advanced age, but I think that I always saw it as risky. And I think it needs more controls before I would be comfortable getting into that situation. And you know, if any of you have seen this Social Dilemma, you know that there's a nice portion about a young girl who gets to feel that she's not good enough because maybe her ears are too big, and it's just sad. It's a and I think you might have to consider the idea that the worsening of youth, the depression and anxiety which I presented, that's been occurring even pre-COVID, might well be due to social media and the internet.
Thank you.
All right. Well,
And I had a question, if I can ask. You know, you showed some surprisingly positive numbers on access to care and access to mental health providers for Maine. And I was wondering, what are your thoughts on access to care and access to mental health providers for rural Mainers and possible rural urban disparities that exist in our state?
yeah, I think that's a good question. I think that the good news is that here's something positive about the internet. I think that we're going to see, as a result of COVID and telehealth and so forth, we're going to see a lot. We're never going back. We're going to see a lot more telehealth, and that will help the rural areas. But it probably won't resolve that problem completely, especially for a serious mental illness, schizophrenia and the bipolar disorders and so forth. I don't think that you can go right to telehealth, and there needs to be a better match. And the truth is that we really don't know, as I said in my presentation, we don't know what the match is. That's data that needs to be dug into. And that's where we in public health can help mental health. What is really going on in terms of access? And I think probably you will find that those in the rural areas are not getting the access that they need. And of course, for substance use disorders, it's particularly noticeable. Washington County, for example, may not have what it needs to address that. So you can have a whole lot of healthcare providers, but if they're not matched up with the needs, either by in place and by type, I mean, I think youth in this country in this state is having a difficult time accessing care, and that may be part of the mismatch. But I don't know enough about it.
Thank you. Yeah, that's a great point about the match between the specific need and the specific services or providers that are available.
Yeah.
I was also wondering if you could talk a little bit more about the impact of COVID and social isolation and how that has affected, mental health and substance use disorder rates
Well,
and
we already
outcomes.
know that substance use disorder is increasing in Maine. There's been evidence that the rate of death is increasing in Maine. And, there's a number of things that could be contributing to that. There's less support out there probably. So I don't, we don't know, but I think social isolation has varied effects depending on who you are. For example, in my case, I'm an introvert, so it's perfect for me. But for those who need to be out there socially interacting, and I know that was the difference between, for example, me and Dora Mills. Dora is wonderfully extroverted, and people who are extroverted, it's a very, very hard. And actually, one of the calls I took related to that, frontline calls that I took, someone who was more extroverted and felt very troubled and disturbed by having to not being able to get out and meet people and hug them and talk with them and so forth. So it can, well, I mean, you're seeing it already. And I have to say, I think COVID is just the tip of the iceberg in terms of pandemics. I think we're going to see plenty more. And it's partly the press of population. We're all traveling anywhere we want to go and so forth. So it seems like, unless we change our ways, it's going to continue, the pandemics in the 21st century. I mean, COVID might be this one for 10 years, but we'll get more. So. That would be it.
Great. And there is one more submitted question that I'll read. What are the barriers for males connecting with mental health support, and what can we do to help?
Yeah, that's another great question. I think that the barriers for males have to do with what we project as ideal male persona. And the ideal male persona kind of goes back to the Pleistocene era, where you are strong, you defend your family, and you have no weakness. And so I think men have come to believe that it's a weakness to consider mental health, and that's a girl thing, and they're going to have to get beyond that. And in terms of what can we do to help, I did see a good presentation actually about the internet, where there was a group that were trying to reach out to men. Also among my resources is a website that is built especially for men. But we're going to have to decrease the stigma. So people who are considered, strong men are going to have to come out and talk about how they accessed mental health care and how important it was and so forth.
Great. Well, thank you again for a great presentation, very thought-provoking topic. I see we're out of time, but thank you all for attending, and please remember to take the session evaluation under the feedback section on your session webpage. And
all right, well, thank you very much, Leo, for standing by for me, and I hope our paths cross at some point in person.
Likewise.
Take care.
Thank you very much.
Thanks. I'll stop screen sharing now, I guess.